Dr. Mora here is going to show you what aspirating a knee is like. Aspirating is another word for removing fluid, okay? Aspirating. So this patient here has right knee arthritis, and I'm very lucky that my dear patients allow me to record this. And I'm doing it to educate people about aspirating a knee because it sounds terrible. You're getting a big old needle in the knee. I mean, that's a scary sound. I just had it done the other day, and it was scary for me too. So how do you know if there's swelling? The bubble's right there. That bubble's right there. If the bubble was at the top, that'd be a different type of swelling. So what I do first is I use some alcohol here, clean the area off. I look for my landmarks, lateral aspect, LV patella right there, quadriceps tendons right there. And usually right about, see, I can push the patella towards me like that. And then right here is the quadriceps right there. Right there is the target spot. Indentation with my needle cap. Betadine, I like to use alcohol and betadine for safety purposes. There we go, just like this. And then 27 gauge needle right here. Squeeze the cap a little bit, or sorry, the thigh a little bit there. I just did that. Tell the patient it's going to burn a little bit. It's going to burn a wee bit, okay?
Yeah.
Just a lidocaine, 1% lidocaine, 27 gauge needle. Go like this. Some people would go right in with a 22, but I like the 27 so that I cause less pain. So you can see the little bubble forming. Just like that, go a little bit deeper. I just leave my, I'm gonna do a little bit more. Let me make sure I'm in the right track. Okay, are you okay, sir?
Yep.
Good. I leave my needle there just for the purposes of knowing where to put the needle next. Are you still okay?
Oh yeah, I'm good.
Good, thank you. Let me know if you feel anything terrible, okay?
No, I'm good.
Okay, good. Then what I do is I switch over to a 22 gauge needle. 22 gauge needle because that's the one that will be used to aspirate the effusion. I put it back on a little lidocaine just in case, but here we go. Keep an eye on the ball. Keep an eye on the ball. There is a trajectory right there. See, I follow the trajectory, move it out of the way, squeeze the cap a teeny bit. You still okay?
Yep.
Right, good. And then if this goes in really easy, which it does, most likely I am on target. So I take that off for just a second. I go ahead and replace it with a bigger syringe. This is a big syringe, it's probably an overkill. It's a big one. And I recommend using a little bit smaller one, but it's just the one that I had today. And I go like this, and then I aspirate. And then if you look closely, what you see is yellowish, or what we call straw-colored fluid coming out. I like to call it like a beer color, like clear beer, like Budweiser. That's what's coming out. And if it does look like beer, such as Budweiser, then you know that it's healthy looking, normal arthritic synovial fluid. If it comes out looking like wheat beer, then you know that it could be gout, or there could be an infection, or it could be pseudo gout. So just remember that lesson. If it looks like beer, you're probably okay. If it looks like wheat beer, which is a cloudy looking fluid, you should maybe consider sending it to a laboratory for analysis, including crystals or even an infection. So this is perfect, normal straw-colored fluid coming out. And as you can see, the bubble in the patient's knee over here, it's less, it's going down, and my syringe is getting filled up. So I'm taking this fluid out today for the purpose of symptomatic relief, but also because I'm going to be injecting some platelet-rich plasma to help with the arthritic pain. This is Dr. Mora showing you what a aspiration of a knee is like. And the last thing I want to ask is, sir, did that hurt very much?
No.
What did you feel?
Like, not really anything.
Okay, not really anything. I love it. This is Dr. Mora. This is how it should always be done. Hope everybody has a great day, and hopefully this will decrease people's fear before they go see their doctor if they've been told they need to have a knee aspiration. You guys take care. Have a great day, and thank you so much for being interested in what I do.